on this computer. Okay. Good morning, everyone. Glad to have you with us. I'm Jenny Biggs with Aging Together, and this morning we have our last summer series session that we've been putting on. It's care options and building a care team, and we'll turn it over in a minute, but I just wanted to welcome everybody and remind you about Aging Together, who is hosting this event. We cover 5 counties: Culpeper, Madison, Rappahannock, Fauquier, and Orange counties, and here comes someone. Have to keep an eye out for everything. But we have monthly team meetings of what we call and meet together with senior serving professionals. And then we have our wonderful website and provide resources and referrals for people from all 5 counties. So please check out our website at agingtogether.org. You'll also see all of our upcoming webinars listed there. And that, of course, that's where you register. And then we've got all of our events that are coming up on there and a big alphabetical listing of resources for all 5 counties. So thank you again for joining us. And I'm going to turn it over to our partner, Lisa Dodson, who's with the Harbors of Renaissance. Did I say that right? And Lisa is a very active volunteer with Aging Together, and she's going to introduce our speakers. So there you go, Lisa. Thank you.
All right. Well, thank you. We're so excited to have Sue Vantine with us this morning. Sue her company is NovaCares LLC, and Sue is a community care manager. She's a professional guardian and conservator for seniors and a past director of 5 home care franchise locations. She's been in the senior healthcare industry for over 30 years and has a passion for helping seniors and their families navigate the healthcare system. Sue brings a wealth of knowledge to the industry with a focus on patient advocacy, caregiver burnout, helping seniors maintain dignity and independence, dementia training techniques for the caregiver, and senior abuse protection. And with that, Sue Vantine. Thank you, Sue.
Thanks, Lisa. So I'm here to talk to you about the care options and building a care team. I have been in the senior industry. I just recounted, it's close to 40 years now, and have been a caregiver for 40 years of that. And there's nothing more rewarding than being a caregiver, but it's also very challenging, as anybody who's ever been a caregiver or in the industry well knows. It takes a village. And so as a care manager, I help families navigate the healthcare system. I have moms in Florida, and son wants to bring her closer to him here in Virginia. Dad's in Warrenton, and I'm in New Hampshire. What do I do? How do I do it? Where do I go? What are the resources out there? Grandpa's caregiver is taking his money. You know, how can we stop this? I mean, there's just so many different scenarios. And as a care manager, patient advocate, I try to help navigate through all of the resources that are available. And there are a whole lot of resources. So I wanted to start with the care options and building a care team by taking a look at, trying to see if I can move my screen. There we go. Taking a look at the continuum of care. The continuum of care is just the whole community full of resources, and how you can hear my dog. It's supposed to be quiet, but he's outside the window. And so I wanted to go through the continuum of care. And so when you first take a look at, okay, if something happens and you have to go to the hospital, the purpose of going to the hospital is figuring out what's wrong. Why are you here? So getting a diagnosis and treating, and then you're discharged. You do not recover and recuperate in a hospital. They find another place for you to go to do that recuperation. And there's a lot of options within the communities for that recuperation at that discharge. You have a social worker and or a case manager in the hospital setting that's going to kind of figure out what's the best discharge plan for you. Is it going home? Is it going into rehab? What are all of the options for the best chance of recovery from whatever illness, accident, or injury that has taken you to the hospital? We take a look at activities of daily living when we're making decisions. And so just as a recap of activities of daily living, there are 8. There's self-care tasks, and that's bathing and bowel and bladder management, dressing, eating, feeding, mobility, being able to transfer, get yourself up and out and walk, and personal hygiene and grooming. And then the last is toileting, complete active urinating and bowel movement. So those are things that we take for granted every day that we can do. But when you're sick or you're injured and you need to go into the hospital, we're going to look at, can you resume the activities of daily living, and what do you need help with in order to have the best discharge. There's IADLs, instrumental ADLs, that we also do on a daily basis. And they're not necessarily for the functioning of the fundamentals of life, but they do allow you to continue to be independent, like housework and taking your own medicines and managing your finances and going grocery shopping and using the telephone and cell phone and computer and technology and just being able to drive. So those are IADLs. So when we talk about what do you need and you know what activities of daily living are you limited in because of your accident or illness that got you into the hospital, but also can you still perform your IADLs, and where do you might need help with that as well. So that's the basic and just a little bit of background information on what we're looking at with activities of daily living. And for those of you that aren't in the healthcare industry, we always use the acronyms ADLs and IADLs. So one of the first things that might be an option is a rehab or a skilled nursing facility. And this is where you would go to regain your strength and your ability to function to the level before the accident or the illness. So can you go to a skilled rehab facility and get back to your baseline? Medicare will cover it if you're 65 or older and you're under Medicare, up to 100 days. The first 20 days is covered at 100% and then 80% thereafter. So a lot of people have secondary insurance, maybe Blue Cross Blue Shield, or there's a number of different secondary insurances where Medicare will cover the first 100% the first 20 days and then 80% thereafter, and your secondary insurance will pick up the rest for a full coverage. And that's in a rehab. So you may refer to a rehab as a nursing facility rehab. There's usually 2 sides to a rehab skilled nursing facility. One side is the rehab, where Medicare will pay, and the other side may be long-term care. So that may be an option as far as a discharge from a hospital. There is what's called acute rehab, and that is where it's an intensive form of rehabilitation, in which, you know, the patient's going to get more intensive, probably 3 or more hours of core therapy a day, whether it's occupational therapy, physical therapy, speech therapy, and it's more of a hospital setting. Usually stroke or car accident patients, and it's more intensive, and usually the length of stay is maybe 10 to 12 days because you are getting such intensive rehabilitation there. Your skilled rehab that I previously talked about oftentimes tends to be a little bit longer than an acute rehab. But nonetheless, either one of them, you have to qualify for the level of care that these types of discharge locations will provide. And there's different qualifying factors. Before COVID, you had to have a 3-day hospital stay. So if you were just in there for observation in the hospital or only had 2 days and then discharged, you're not going to qualify for a skilled nursing rehab or an acute rehab. The next one is home with home health. So can you go home and have just home health come in? Home health is when you return to home and an agency, a home health agency, comes into your home and provides skilled nursing, to take a look at your medications, provides physical therapy or occupational therapy or speech therapy. It does require a doctor's order, and you must be considered homebound or under the care of a physician. So you can't be out participating in the community and going shopping and, you know, doing all kinds of fun stuff out in the community and still receive home health. You need to be considered homebound. And so this also home health, where a specialists in physical therapy and occupational therapy can take place in your home, and it can also take place in an assisted living facility, and it is covered by Medicare. My computer doesn't want to move my screens very well. We'll go back to that.
Right.
Another option is going home with home care. So maybe your spouse works full-time or isn't available to take care of you. And so sometimes home care can be referred to, and it gets very complicated, especially for seniors, to really understand what's the difference of home health and home care. Home care is a non-medical care or private duty. It's just aides that come in and help you with meal prep, medication, taking your medicines, helping you take a bath, and just making sure that you're safe, maybe helping supervise you transferring or walking so that you don't fall. It is private pay, so it's out of pocket. If you have a long-term care insurance policy, oftentimes, depending upon the policy, it will pay for home care to come in. And there's always the VA, Veterans Administration aid and attendance benefits. If somebody has been in the military and or their spouse, they may qualify for aid and attendance benefits through the Veterans Administration. So again, the difference between home health is it is covered by Medicare, and it is professional physical therapists, occupational therapists, or skilled nursing that comes into the home and helps you regain your strength and get back to as best to your baseline as possible. Home care is to help you with your ADLs that you cannot perform, and you just need some supervision and a non-medical aid to come in and help out. There's the option of going to an assisted living facility. And so an assisted living facility it's a housing facility for individuals with physical or cognitive needs. They provide supervision and assistance with the ADLs. They coordinate services by bringing in home health providers. They coordinate your physician cares, your therapists, you know, they can draw labs, monitoring of activities to help ensure safe and well-being. So they're staffed 24/7 in an assisted living facility. They also provide your medication management and personal care within the facility. And it really is an alternative for people who just can't live independently or no longer safe in their home. And but they don't need 24/7 medical oversight. There are aides that are there throughout the day and the night that can assist them. And it provides a lot of social interaction, dining, activities, outings. So it really is an option for somebody who can no longer live at home by themselves or doesn't have the support or the ability to, you know, have people come into the home, to have the option of going into an assisted living facility. And there are quite a few assisted living facilities in our area. This is, again, private pay, or if somebody has long-term care insurance, oftentimes it is covered depending upon the policy, or the VA aid and attendance benefit. Any questions so far? Nope.
No, I was going to ask you about the veterans, so I'm glad you brought that up. Thank you.
Yeah. The next would be long-term care. So sorry, I'm juggling around trying to see my slides and move you all at the same time. But long-term care oftentimes is the other side to a skilled nursing and rehab, where somebody's coming out of the hospital and they're getting that rehabilitation in order to be able to go back home But the other side to it is where people will go when they can no longer go home and no longer live alone. So it provides a variety of services that meet both the medical and non-medical needs of people with a chronic illness or a disability who just can't care for themselves long-term. The staff are on site 24/7, and long-term care is paid for private or through long-term care insurance, or when money runs out, Medicaid. So Medicaid, a lot of the long-term care facilities are Medicaid approved to accept government funding. And that's another whole presentation is Medicaid, right?
Mm-hmm.
Yeah. So another option would be memory care. Memory care, there are more and more memory care units and facilities that are coming into our communities. And that's because dementia is soaring, especially through the pandemic. It has really, because of isolation, dementia has accelerated, and more people are being diagnosed with some form of dementia or another. But in memory care, it's a distinct form of nursing that specifically caters to residents with dementia. There's memory care neighborhoods. They provide 24 supervision. It's a secure setting. They provide additional assistance with activities of daily living. The caregivers are specially trained with dementia and how to best work with people living with dementia. And they're trained to assist people who also have impaired cognitive impairment. Most of the memory care units that are out there have a strategic physical layout and security. So door alarms or doors locked. And the layout is really designed for somebody who has cognitive impairment. And it helps the person who's living with dementia not be stressed, not have aggravated or agitated behaviors. And it really gives them the opportunity to be able to be as independent as possible while being monitored. We've got palliative care. And palliative care is when you have an illness, maybe like a cancer or some kind of a disease where the focus is on the quality of life, both for the patient and the families. So it's often offered alongside the treatment of a disease. So it focuses on relieving pain and the symptoms from the serious illness or the disease. But you're also being treated at the same time for the illness or the disease. So it's really to bring comfort, and it can be provided in the hospital or in nursing homes, outpatient clinics, or at home. Palliative care is a program oftentimes offered through a hospital or through a hospice company that just really helps the quality of life. And it is covered by Medicare. And we have hospice. So hospice care, it's a special kind of care that focuses on the quality of life, just like palliative care does. But it's for the people, the person who has a terminal illness, an advanced life-threatening or life-limiting illness. And it provides a very compassionate type of care in the last phases or the last weeks, months of life of an incurable disease. So it allows the person to live comfortably, normally not being treated, but more comfort care. And it is covered by Medicare. Respite care. This is very much needed and very becoming more and more popular because more and more caregivers are taking care of their loved one, maybe at home, especially during the pandemic, and they're getting burned out. And so respite care provides a temporary relief for the primary caregiver in that the person who they're caring for has a place to go and stay and allow the caregiver to go away or take some time by themselves and take some time off from being a caregiver. And it can take place in your home. It can take place at daycare centers, adult daycare centers, or residential or nursing facilities where the person who's being cared for can stay there in a safe environment and the caregiver knows that they're well taken care of. So a lot of assisted living facilities and even nursing facilities will offer respite care. So the caregiver can just rejuvenate and embrace the caregiving journey. We have senior centers. This is big. This is it's a type of community center, really, where older adults can come together and fulfill their social, physical, emotional, and intellectual needs. It does lots of activities, music. Provide a lot of the senior centers will provide meals, some educational programs, can do some exercise and some fitness programs. They'll also go on outings, so they provide transportation, social and recreational activities, and arts and educational, and just lots of intergenerational programs. So senior centers can be offered standalone adult day centers or through the community to be able to offer the different senior centers at a lot of times a Parks and Rec or someplace like that. And then there is a geriatric care manager. So this person, like myself, is a person who really helps navigate the healthcare system, providing guidance, options, benefits, healthcare solutions, resources, and recommendations. Really more like I consider myself an air traffic controller. Just everybody's situation is unique. We have lots and lots of community partners within each geography. And it's just knowing what's out there and what's available based on the unique situation that you're helping the family. And they really can, they can help navigate through the senior care system, just helping the caregiver who's in crisis and who just doesn't know what's available out there, who to talk to, where to go, and just being able to help resolve family issues, which can oftentimes occur when there's different personalities in a family and they can't come to a united decision. So this is private pay, and sometimes it is covered by long-term care insurance, depending upon the policy. So I always say, as a care manager, have a plan. You know, don't wait until you're in crisis and have an accident or an injury or an illness before you have to make a very quick decision on what to go, where to go, how to go. So kind of create a plan ahead of time for the what ifs. What if you need to go to a rehab? Are you familiar with what's out there? What are your choices, and where would you want to go if you needed to rehabilitate somewhere, and where would you not want to go? If you were to be able to go home with home health, what home health company would you want to use? And what one would you not want to use, based on people who have experience using ones and had great success with them, and others that have been disappointed. So what if you needed to go home, but you needed extra help with a home care company? What home care company would you use? It's never too early, if you're a senior or a family who's caring for a senior, to get set up with a home care company for the what ifs. What if you needed extra help? You know, you can already be a client of a home care company without having to use them, but have them on board for if you did need them. And what if you can't stay at home anymore? What assisted living would you want to go to? I remember always telling my mother, you have the opportunity to be able to pick out where you're going to be able to go or might need to go ahead of time. So let's look around. Let's see what you like. Let's see what we're hearing out there. Let's see where we absolutely will not go. Because you don't want to wait until you're in crisis to make these kind of decisions. You want to kind of have it in your back pocket and be able to, hey, this is out there, and if I ever need it, this is my first choice, and this is my second. And then, of course, and nobody wants to go into a nursing facility. Of course, rehab, you have the idea that you're going to go back home after rehabilitation, but I don't know anybody who says, I want to go to a nursing home and live there. You know, so it's something that is provided and needed. But where would that be if you needed to go into a nursing facility? And where do you not want to go? And so I help navigate especially nursing facilities, because there's Medicare.gov and you can look at the ratings, you can look at the inspections, you can look at all of the citations and deficiencies and see, no, don't want to go here, or yeah, this is a good one and this would be my first choice if I had to. So I am big on having a plan A, plan B, and plan C, because because the what ifs happen at the snap of a finger, and families just aren't prepared, and they're in crisis, and they're at that point, they're making emotional decisions, and they may not know where to turn and where to go. So I like to be proactive and have some things in mind for when that time may come. And of course, we're always looking at money options for care. It seems like, just in general, seniors like to save their money to leave to their kids, and they don't want to spend what they have in their savings or their investments. They're willing to spend their monthly income, but not what they want to leave for their kids. And this is the time when they need to be able to use that money on their own care for their own self, because they're still here and they need it for them. And that's why they have been saving. So the money options as far as the care is, some of the places, as I discussed, will accept Medicare as the payment, 100% or 80%. And then the secondary insurance will oftentimes pick it up. And that's if there's a medical reason to be able to get them back to their baseline. So a hospital stay, going to the doctors, going to a rehab, home health. So we're recuperating somewhere. And that's where Medicare and a secondary insurance will pick up. Long-term care insurance will pick up if somebody has it in some of the private pay situations. Assisted living is private pay. Home care is private pay. Long-term care is private pay. So that's where, if somebody has a long-term care insurance policy, as long as the policy has those benefits, that can cover some of the bite of the cost of those types of care options. The Veterans Administration has an aid and attendance benefit, and not a lot of people know about it or know how to get it. There's a lot of red tape in order to do it unless you know what you're doing. Elder law attorneys are starting to specialize in getting aid and attendance benefits. Care managers can help do that as well. But it is out there for somebody who has served in the military during wartime, only 90 days during wartime. They don't have to have been in the war, but just during a wartime. And we've had plenty of wartime. And the spouse is also eligible. And it is based on income. There's Social Security disability benefits. A lot of people don't know that they may qualify for additional Social Security disability benefits. So that's something to look at as well. I see a hand up. Do you want?
I have two questions, but one is regarding what you just said about the SSDI.
Yeah.
Do you know, can a person receive SSI and SSDI, or is it one or the other?
I think it's one or the other.
Okay.
I think it's one or the other. So.
Right.
And again, that stands for Social Security Disability Insurance. Income. Okay.
Mm-hmm.
Right.
Mm-hmm.
But if they're just, getting straight Social Security and they have a disability, the SSDI can be considerably higher than just plain Social Security that, they worked for.
Okay. That helps, because I was kind of posed with that question, and then I was just like, I'm not sure how that, and then trying to call social offices, forget it.
You got to know someone there.
Pretty much.
You got to know some management there, and so it's always worth looking into. I'm always trying to find what people are entitled to. I mean, we've paid into Social Security. Veterans have served, our country. These are what they're entitled to and we're eligible for. So let's go after it and see if we can't get some extra income for their care. Because because if we don't draw the benefits from some of the agencies that have benefits that people are eligible for, then what's going to happen is at some point, our government is going to pay for our care, and that's going to be Medicaid.
Got it.
Right.
Okay.
Sometimes when I'm trying to help people navigate, we can cash in a life insurance policy. A lot of times if they have and they've had life insurance forever, there could be a life benefit, a cash value to it, and that could help provide care for them in their home.
Okay.
I do a lot of I do a lot of guardianships and conservatorships for adult protective services. And if I can keep somebody in their home safely, that's what I like to do. But I need to know that they're going to be safe. So I install cameras, I get aides in there. I got to have trustworthy agencies that are going to make sure they show up and do all the right things. But in order to do that, oftentimes I'll do a reverse mortgage. I'll get with a mortgage company and take some of the equity out of their home. Not all of it, because they're trying to leave it to their kids. But maybe you can take up to 60% of the equity of a home for the care, as long as they live in the home. And so that's always an option. And then I help people also apply for Medicaid. So Medicaid, you can apply for Medicaid if all of your assets are under $2,000. So you can still be living in your home, and we can get Medicaid approved for some home care in the home if you're living there. But if you need 24/7, we're going to have to spend the money down. And when it gets to a level where there's 2,000 or less, then we can apply for Medicaid, get approval, and get you into a facility, and the government's paying for that. Yeah,
it's challenging. I'm living that life right now. So I'm in this role with Cornerstone Cares, but I am a caregiver. So my dad's full-time caregiver. So this has been a learning process on both ends, personally and professionally for me. So that's why I'm asking questions. Some of it is for my personal use, and then this is also great because I can share it with others. I literally just had a conversation with someone yesterday. I just decided to text a friend yesterday and say, hey, how are you doing? How's your mom? And she called me. She's like, oh my gosh, I need to talk to you. And she's going through a situation with her mom where she needs some support. And I said, well, you've got the right person. That's what I'm doing. She said, yes. I said, but I'm actually working in that role now. And so I'm going to meet with her Thursday, and we're going to have a conversation. And a lot of what you're sharing with me here, I'm definitely going to recommend you. Everything that she said she's dealing with, is pretty much everything you've mentioned here.
It's a heavy load. It's not easy being a caregiver, and we need to all support each other, but there are those resources out in the community, and it's just a matter of finding them. And so for the person who is not in the community and knowing what's all available, it can be quite overwhelming. And then it can cause family conflict. And then it just is a spiraling burn down effect. So yeah, I mean, this isn't about me, but it's more about, this is what's out there, and let's get it. Let's provide the best care we can for anybody and everybody. I love this part because it is so, and again, I'm a very proactive person and not reactive. So I want to know, okay, what am I going to do if, and you're in the center, the patient, the client, the caregiver, you're in the center. It's you, and it takes a village. So don't be afraid to call on your close friends. People love helping people. So your friends and your family are your core. And then outside of that is the medical team. And then outside of that is all of the community resources. So your care team is your family. It's your church. Your church is there to serve you and help you. It's your friends. It's the medical staff and all of the different options that are available, the assisted living, the skilled nursings. It's the hospice. It's the area on aging that can provide transportation and meals. It's the aging together and the networking between all of the professional community partners out there, and keeping that socialization going to make and help everybody continue to stay as independent as possible and as whole as a human being should. So that's it. That's what I got for you. Any questions?
Wonderful.
Me again. I know I have tons of
Yeah,
questions.
go ahead. Go ahead.
And again, it's because it's
It's
personal,
good.
and professional
Yeah.
for me. I have tried really hard to build a care team, and I'm grateful for those who have stepped in and helped me. I will just share this on a personal note. My 50th birthday was the other day, and I was just like, my original dream plan clearly was not going to happen. We were going to Puerto Rico, not going to happen. But just to get out of the house, it's a milestone birthday. You know, my husband and I, like, we couldn't find anyone to just, just be here, and just literally kind of like at the last minute, my neighbors, God bless them. They're Christians and I'm grateful for them. I really am.
Yep.
They took turns. They're school teachers. They took turns coming over to sit with my dad for a couple hours each while they graded papers and everything. And then one of the ministers from church came over and she stayed the night with my dad. She stayed overnight and cared for him. So my husband and I could go out and I could just have a night out, just us. And literally, we just
You were on respite. You had respite.
I needed that so desperately.
That's
But
wonderful.
beyond that, beyond, I don't want to burn these people out, and we're in Bealton. My dad was living in Alexandria. And so the family is kind of on that side of town. So to call them and say, hey, can you come sit with him so I can run to the grocery store or whatever it is I need to do? Impossible, not going to happen.
Right.
Locally, like I said, I have church and I have my neighbors. However, for things such as I have a doctor's appointment tomorrow, I have to take him with me to my doctor's appointment tomorrow morning because I don't have anyone. I've reached out to, as it stands, I think 3 different agencies. Finding respite care is difficult. It's very challenging. One lady just came straight out and told me, she said, I'll be very honest with you, Ms. Ursula, if it's not full-time work, my aides don't want to do it.
Yeah. Yeah.
And my thought is, aren't you in this for the people? I mean, I understand you need to make a living. I totally get that. But what about the people that need the care? Like, I don't know.
Well, there's an aid shortage right now because of coronavirus and the pandemic. For the last year, in hospitals, nursing homes, home care companies, home health, there definitely a shortage of aides out there helping. And so what that does is it puts the caregiver in a deeper crisis than if we were able to get the extra help. Build your team. I know I just did a support group on Saturday. And it was for caregivers of those caring for a loved one with dementia. And, a support group is supposed to be 6 people, 6 or 8, maybe. I had 35 show up. And so 35 caregivers that are just desperate for support come together and tell their story. And it took the whole 2 hours to go around the room and everybody tell their story. But the bottom line and my biggest message for everybody as a caregiver is take care of yourself. You have to take care of yourself. You cannot take care of another person if you are not breathing. Right. And so find a way to breathe. If you're on an airplane, how many times have you gotten, the instruction that when the oxygen masks come down, who are you going to put it on first? Yourself. So as a caregiver, you need to take care of yourself so that you can better take care of the person you're caring for. So take that respite. People want to help. Let neighbors help neighbors. And if, through a support group, try to go to a support group if you can, just one, and you'll connect with 2 and 3 and 4 different people and use each other to almost just as you would what they used to call it back when I was raising my children, where, other mothers would come and babysit for you and you would babysit for them. And it would just be a nice exchange. But you can do the same thing in the caregiving industry as well. And take that time and care for yourself.
Yeah. And Ursula, I was going to suggest, I know you're new to Cornerstone Cares, but of course, Sarah Amos was in the position before you, and she just knew everything caregiver and also used to run so many wonderful webinars. But she's now working down in Culpeper to open up a brand new adult day, which will be after the first of the year. And meanwhile, what they're doing is a senior connections club. I don't know if your dad would be eligible to go there, but they're doing a lot from September through December. Have you seen and heard about those?
Yes,
Okay.
ma'am. She sent me
a call.
Yes,
Yeah.
I am definitely reaching out. Tomorrow's Wednesday. Tomorrow we have a little call, and yeah,
Oh, good.
I'm looking forward to doing some things. He's there was a point where he was not able to do anything for himself, but he's able to move a little bit with a walker and things. So I want to get him up and out, and I
Right.
don't want him to be isolated. I don't want us to feel isolated, because I've had that moment of burnout, and
Mhm.
I don't ever want to go there,
It-
ever.
It's
want to go
not
there.
selfish to take care of yourself. It's
And-
not. You'll be a better caregiver.
Oh, yeah.
And one of the things that I say is that your dynamics of daughter and father are now changed, right? Okay. Yeah. You're the caregiver. And so those dynamics are not the same as they were up until the point you became caregiver. It's a whole different role.
Oh, different.
Yeah, it sounds like he's open to your help, which is really great.
yeah.
I wanted to ask for a friend of mine who is taking care of his mom and dad, but mom is basically the caregiver. I mean, these are friends that are in their late 60s, so his parents are in their whatever 80s and early 90s, and the mother is taking care of the father, and he's a veteran, but just not open to anything. You know,
Yep.
it's one of those situations, not open to it. So everybody's burned out, including the 80-something-year-old mother.
Yeah.
So how do you recommend, you know, I don't know, how do you turn the tables on that to get someone to open up to ideas? That's a hard one, right?
It really is hard, especially our military. They tend to be, still, fighting the battle, if you
Right.
will. Doctors are extremely difficult to take care of.
Yeah.
And it's just, what it usually
Oh,
takes,
good
and
point.
being a dementia trainer, this is what I try to guide the caregiver. There's usually at least one person that we'll say your father, the client, respects and will listen to. I don't know if it's his doctor. I don't know if it's his lawyer. It could be his close friend, but there's usually, so find that one person to be the messenger, not you. I mean, unless you're the person,
That person.
but you're the caregiver,
Mhm.
right? So you've got that role. And so then there's some kind of authoritative figure that your father or the client respects and will listen to. And so that person can talk with them and maybe help them make sense that, hey, we need to get some extra help in here for you.
That's
And
great. Yeah.
spearhead it. But try to identify who that authoritative figure is that your father or the client respects.
Yeah.
Yeah.
Okay, that's good. And I was going to ask if I can figure out how to do this, if everybody was okay. I just want to share the Aging Together page too, just
Yeah.
because
Yeah.
Ursula, we did a wonderful a veterans resource webinar last year. I think it was, I'm trying to think, it was in February, because we were supposed to have it in person. We had a huge turnout the year before when we did it in person. And so we had a webinar that was a great program too, and lots of speakers. And we put together a 3-page resource guide just for the veterans. So it's all on our agingtogether.org website page, and just go to recorded programs. Scroll down and you'll see all the different topics we've done, like this one today will be there, and you can watch them over and over. And then you can print out that resource guide for veterans and just keep it at your desk or when people call. So that's one really great thing. And then even on our homepage of Aging Together, we've got a 90-page, we just this year during COVID put together our very first regional resource guide for older adults, and it is 90 pages long. We printed up 1,000 of them. They're all gone. We've hit 5 counties, so they're out there, but we're trying to get more, and there is a digital copy. So you can also save that and download it or print it if you want to. And it's alphabetized by veterans or by, caregivers and support groups and different things like that. So I really encourage you to take a look at our website for everything.
Yes, ma'am.
And then,
And don't be afraid to accept help.
right.
No shame here.
Yeah.
No shame here. So it's like, first I was just like, oh, I can do this. I can handle it on my own. And that's how I became involved with Cornerstone Cares, because I was in that caregiving role and I needed some support. I needed that extra oomph. And they've really pushed me over the edge, as far as, not in a negative way, in a positive sense, pushed me over the edge and said, okay, Ursula, you've got to, get up and get running with this. There's more to it than just sitting at home with your dad, feeding him and giving him meds all day and then feeling sad about it. No.
Right, right.
So
You said you and your dad live in Bilton?
yes.
Okay, because I was wondering if you were familiar with the Reverend and Mrs. Champion. They run an
I attend
organization.
TDC.
Yeah,
That's my church.
they
My
call
husband's a
called
youth pastor
Community
there.
Touch. What's
Yep.
that?
My husband's a youth pastor at TDC.
Oh, there
That's
you
who
go.
we
Well, that
attend.
is your church
Oh,
family right there.
yeah.
And
That's
not
who,
to
that's
mention,
who mostly has been
okay,
the most support, I should say, is the
oh my
ministers.
goodness. All the
Mhm.
programs that they offer there are just
Yeah.
incredible. So,
They love them dearly.
oh, wonderful, wonderful.
Mhm.
Was one other question. I know what I was going to, when we're talking about the cost of everything, and because everybody's just so afraid of that, of course. And I hear, oh, we got an opening this month and the beds are this much for the month. And it's just, whoa, you go, oh my gosh, I can't afford $8,000 a month. But somebody said something to me once, which really stuck in my head. And when you compare that you're moving out of the home, that when you look at what you spend on your mortgage payment and all your food and all your medical bills throughout 1 year, it comes out to about the same. Is that right? Would you say sometimes that? So it's a good way to make sense of it and understand that you would have spent that anyway if you were staying in your home.
Yeah, it's a good way to justify the cost, because we do an analysis. Oftentimes I'll present an analysis. Here's your mortgage, here's your electricity, your water, your trash, your food. You take for granted because you're used to spending that money all this time. And when you come up with that total, yeah, it's very, it could be even less expensive to move into, a retirement community than it is to stay home. And then you have the socialization and the medical ability access there.
Do we have many places in our region that are what do you call it? You start out in your independent, but then can move into assisted, into dementia care, and eventually into.
Yeah.
Do we have many of those around? What do you call
the Culpeper is a beautiful big one. I have clients there. Trying to think of some of the, what's that?
What kind of facility is that called?
They call it a CCRC. Sorry, that's an acronym. Continuous Care Retirement Community.
Oh,
okay. A CCRC.
Mm-hmm.
So typically you move into independent living. It could be an apartment in the main building or a cottage. And then you have the ability, as health declines and you're not able to perform your own ADLs, to go into assisted living. And then as the decline goes on, there's long-term care, and usually there's rehab there on site too for their own people that live there. And then there's memory care. So I know the Culpeper is a big one, and it's beautiful.
It is beautiful.
Yeah. Trying to think of what else in that region.
Yeah.
I don't think there's a Westminster Canterbury down that way, but the Culpeper just out. Yeah.
That's where my mom lived, in Richmond, and it was beautiful.
It is beautiful.
It's wonderful for her.
My in-laws were at the Westminster Canterbury in Winchester, and I have a client at the one in Charlottesville. So very nice.
Very nice. Yeah, definitely. What else? Let's see. Any other questions, anyone?
That was my only concern, is respite care.
Yes, respite care for you. Respite care.
Well, yeah, and just for others in general, because like I said, I know others that are in the same position that I'm in, and I want to be able to share that information with them as well, so they can reach out.
But Cornerstone Cares, I'm sorry, I thought Cornerstone Cares offered a respite care.
Not yet.
But they used to when Sarah was there.
Well, it's in the works. We don't have all of the legal paperwork together yet. I actually have a meeting.
You'll be first in line.
I am so excited about it. So what we do offer in the sense of respite is respite funding. So there's a minimal amount of funds that is awarded to certain families, so that they can pay someone to come in and take care of their loved one while they get that break, while they
That's
go
great.
shopping or
Yeah.
while they do laundry or whatever. So they do offer that. So you would have to, the caregiver would have to find, someone, but Cornerstone Cares does have, we do offer a certain amount of funds to help offset the cost of it. Yeah, so that's the beginning of the respite program, but we are
Right.
working
Oh,
hard
okay.
on making this a full service program. We do have some members of Cornerstone Church that have volunteered to become respite workers. And so we're trying to build on that.
Yeah, that's
I'm
going to be an
excited.
awesome program.
Oh,
That's
yeah, I am
great.
so excited about it.
Yeah.
That is good. And my last question for Sue is your profession, like, are there many geriatric care managers around? I mean, I just want to, I love what you said about don't wait for the crisis, and make a plan now. And I want to be that person, and put it in the bill and make sure I have an only child, and I know she worries about this, you know what I'm saying? And but my husband and I are totally healthy,
Right.
but something can happen
That's
in a
right.
minute and change all that. So I would love to say, please hire a geriatric care manager for helping you to make these decisions, because I know they don't know the resources. It's taken me my 4 years working for Aging Together to learn about all of this.
There's
And
a
I'm going
lot.
to be eligible for Medicare early next year myself, and it's just overwhelming.
Yeah.
So I just want to put it in place, So are there many people around that do your type of work?
There are a whole lot in the Northern Virginia area, usually the metropolitan area. There's a considerable amount of organizations that have care management companies. I think I and one other are the only two in the geography that Aging Together services.
Oh, I see.
That I know of. I know in the Shenandoah Valley where I live, there's only myself and two others, and we're all three independent of each other. But there are down in Northern Virginia, there's organizations where multiple care managers, and they specialize in that area. So they know the resources. So it's pretty geographical, because if you're gonna know what's out there, you need to really, be immersed in the community to be able to offer different options.
Do the hospitals and all of that, when you're being discharged, do they know about these services and recommend them to the families?
They're limited in what's out there. So I mean, they know, yeah. So there's a lot more out there than what they have knowledge of. Right.
Well, this has been truly wonderful. I love this. Thank you so much. It just makes you really think, doesn't it, Ursula? Yes. I loved your slides, were wonderful and full of so much information, Sue. Thank you. Thank you. I hope everybody has a great day, and we will get this recording up on our website as soon as we can. And please come back and view it anytime you would like, and join us, I think, next month. Oh, just so you know, we're doing another series. This was the last of our summer series on caregiver information, summer caregiver series. But starting on September 2nd, we're doing a lunch and learn, which will be working with at 12 o'clock, 1 o'clock kind of thing. We're working with triad programs, which triad is with the local law enforcement, the community, and older adults working together to provide information and keep seniors safe, and know about the crimes and the scams and fraud that's just going crazy. I got scammed this past week myself. My Walmart food card pickup got hacked, and some people in Florida picked up about $500 worth of food on my American Express. Somehow they hacked in there. Who would think? But there's just so many things going on. So that's what our Lunch and Learn is going to be about. So that starts September 2nd. And just check our website out, and you can register there for those twice a month through the end of the year. So again, thanks, Sue.
Thanks for having me.
You joining us. Take care. Everybody have a great day.
You too. Bye.
Y'all have a great day.
Thanks.